Respiratory illnesses can spread quickly in residential aged care facilities and cause serious illness and even death. This video aims to help people working in aged care facilities to prepare for managing an influenza or influenza-like illness outbreak. This video will cover 1. What is influenza-like illness? During this video, this will be referred to as ILI. 2. How do you know if someone is sick with ILI? 3. How does ILI spread in aged care facilities? 4. Ways to stop the spread of ILI. 5. How to know when an outbreak is over. 1. What is influenza-like illness? Influenza-like illness describes a group of respiratory infections caused by germs known as viruses. For example, some of you may know the viruses by other names such as influenza, parainfluenza, or RSV. The aged care environment places residents, staff, volunteers and visitors near each other, and this means that the germs may spread quickly through the facility and cause illness in many people if not stopped quickly. The elderly are at greater risk of illness because of their age and lowered immune systems. These viruses are very infectious and can cause serious illness and even death. 2. How do you know that someone is sick with influenza-like illness? A sick person may have 2 or more of the following symptoms: new or worsening cough, shortness of breath, sore throat, headache, sore muscles, tiredness, and a sudden onset of high temperature, although this may not always be present in the elderly resident. In addition, the elderly may present with other symptoms such as onset of increased confusion and/or worsening of existing health conditions. Tell your manager if you think a resident or workmate has ILI symptoms. 3. How does influenza-like illness spread? Viruses spread when a sick person coughs or sneezes. The droplets may land on hard surfaces such as tables, doors and floors and can travel up to 1 metre. These viruses can survive on surfaces for 8 hours or longer if not removed properly. If you touch a dirty surface that has the virus on it, you can transfer the virus to other people, including yourself, fellow colleagues, residents and family members. Did you know you can spread the virus before you show symptoms? This means you are infectious with the virus for up to 2 days before you start to feel sick and until you feel well again. If you have influenza, you may be infectious for at least 5 days. 4. Ways to stop the spread of ILI within your aged care facility. By following the steps described in this video, you can stop the spread of ILI at your facility. Get vaccinated against the flu every year. Vaccination is your best protection against the flu. By getting vaccinated, you protect the residents, staff, visitors, and your family. Perform correct cough etiquette. The term cough etiquette means covering your mouth and nose with a tissue when you cough or sneeze. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow. Place the tissue in a covered bin and perform hand hygiene. Hand washing is one of the most important ways to stop the spread of germs, and it's important to wash your hands thoroughly. Did you know there are 5 moments that describe when you should wash your hands at work? These are 1. Before touching a resident. 2. Before a procedure, such as putting in eye drops or emptying a urine bag. 3. After a procedure or when you have touched body fluids. 4. After touching the resident or doing cares for the resident. And 5. After touching the surroundings of the resident or items in a resident's room. To wash your hands, wet your hands with running water and apply liquid soap. It's important not to use bars of soap as they can be contaminated with viruses. Rub your hands together for at least 20 seconds. This is the time taken to sing the happy birthday song 1 to 2 times. Make sure all surfaces of your hands are covered with soap, including your palms, the sides of your hands, the backs of your hands, and between your fingers. Rinse your hands, then pat dry with a paper towel. Dry your hands well because damp hands can spread viruses more easily. Use the paper towel to turn off the tap. You should use a suitable hand moisturiser to keep your hands free from cracks and prevent excessive drying. These cracks can allow germs to enter your body and cause infection. Speak with your supervisor if your skin develops cracks or breaks open. To prevent viruses from spreading and to be able to perform good hand hygiene, it's important to keep your nails short, remove nail polish and artificial nails, remove jewellery such as rings, watches and bracelets, and keep arms bare below the elbows. Alcohol-based hand rubs can be used to clean your hands, but they are not effective if your hands are visibly dirty or soiled. Infection control procedures. We mentioned it was important to follow appropriate infection control precautions to prevent the spread of germs. This includes the use of standard precautions at all times when looking after residents. Standard precautions include using correct hand hygiene methods, wearing personal protective equipment, also known as PPE, when required, encouraging good cough etiquette, isolating sick residents, cleaning shared equipment between use, disposing dirty laundry, waste and sharps appropriately, and finally, cleaning the environment correctly. Remember, ILI viruses can be spread by droplets and touch. When looking after sick residents with ILI, you will need to add droplet and contact precautions to your standard precautions. This means you must wear a gown or plastic apron, gloves and surgical mask. The correct steps for putting on PPE include 1. Wash your hands before entering the resident's room. 2. Put on a disposable gown or plastic apron. 3. Apply a surgical mask. Shape over your nose, tie the top tie first, followed by the bottom tie. This gives a more secure fit. 4. Use protective eyewear if the resident you are looking after is actively coughing or sneezing. The eyewear should go over your glasses if you wear them. 5. Put your gloves on last. If wearing a long-sleeve gown, make sure the gloves go over the cuffs of the gown. Contact precautions for sick residents will remain in place during an outbreak. When you care for your ill resident, your PPE will become contaminated with germs. Do not touch the outside of your eyewear, the front of your apron, or front of your mask. Do not leave the resident's room wearing your PPE. Ensure that hand hygiene equipment is available. Do not use the basin in the resident's ensuite bathroom as it may be contaminated with germs. When removing PPE, take off your gloves first. Dispose of your gloves and perform hand hygiene. Remove eyewear. Next, remove your apron or gown and dispose into the waste bin. Perform hand hygiene. Then remove and dispose of your mask into the waste bin. Perform hand hygiene and wash your hands with soap and water immediately after leaving the resident's room. Remember, most PPE items are single-use only. Use them once, then throw them away and wash your hands. Do not wear the same PPE to look after more than one resident. Do not hang masks around your neck, put them in your pocket, or lift the mask to talk to someone. It's important you wash your hands before you put on and after you take off gloves. This is because gloves are porous or leaky, and it's easy to get germs on your hands when taking off your gloves. Gloves cannot take the place of washing your hands. If you use gloves, you still need to wash your hands. How do I know the facility has an outbreak? If 3 or more people associated with your facility present with ILI symptoms over a 3-day period, then your facility has an ILI outbreak. This shows that the virus is spreading through your facility. Your manager will contact the local public health unit to notify of the outbreak. The public health unit will provide advice to your manager by telephone, written resources and letters. Sometimes they may even come to the facility to provide further support. Specimen collection. Once cases of ILI are identified, your manager will contact the health practitioner associated with your facility. This may include the GP, nurse practitioner, or infection prevention and control practitioner. A swab will be collected from the sick person to identify the virus. It's important that the correct viral swabs are used. The person collecting the swab should follow correct infection control precautions. Communication. Once an ILI outbreak is confirmed, your manager will try to stop the spread of the illness by changing the way you work. This will occur before any swab results are available. Communication is very important in an ILI outbreak. All staff, residents, family members and visitors will be told of the outbreak. Signs will be displayed across the facility to both inform and remind all people of the outbreak. Staff will be asked to increase hand hygiene practices. Don't forget to immediately tell your manager if you think a resident is sick with an ILI. Ask the resident to stay in their room. This will help to stop the spread of the ILI to others. Cohorting of residents and staff. In an outbreak, cohorting of residents and staff reduces the spread of infection. So what is cohorting? Sick residents may be separated from well residents. This is called cohorting of residents. Staff caring for sick residents should not look after well residents. This is called cohorting of staff. To prevent infection from spreading, staff working in affected areas should not work in or visit other areas such as cafeterias, lounges or dining rooms to prevent further spread of infection. Sick residents will be asked to stay in their rooms for 5 days after their illness started or until they are no longer ill, whichever is longer. Residents should have dedicated equipment during an outbreak if possible. If items need to be shared between residents, these should be washed and cleaned well after each use. All group activities and excursions will be stopped until the outbreak is over. Dining rooms and lounge areas will be closed to help stop further spread of ILI. Signs will be displayed to remind all people of the outbreak. Contact and droplet precautions for sick residents will remain in place during an outbreak. Sick residents will have a sign on their door to help alert staff. If a sick resident has a visitor, they should follow staff instructions to prevent further spread of ILI. Visitors should not visit if unwell. Your facility manager will communicate with staff and families about visiting policies during an outbreak. Staff should change their uniforms daily and launder them between shifts. If you have not had your flu vaccine, you have a higher chance of catching the flu and spreading the flu to others. If you haven't had your flu vaccine this year, you can continue to work during an outbreak at your facility, provided you remain well. You will need to follow infection control precautions, which includes wearing a mask even when you look after well residents. Cleaning. During an outbreak, your facility will be cleaned more frequently. A neutral detergent mixed with warm water should be used, followed by a disinfectant solution. Surfaces that are touched a lot should be cleaned twice a day. What should I do if a resident needs to go to hospital? When requesting an ambulance, it's important to let them know the resident has an ILI, as this prepares the ambulance and the hospital for correct infection control procedures. What do I do if I start to feel unwell? If you become unwell with an ILI, it's important you do not work and that you let your manager know. You need to remain at home for 5 days after the illness started or until you no longer have symptoms, whichever is longer. 5. How do I know when the outbreak is over? Outbreak measures will remain in place for at least 8 days or longer after the last resident at your facility became sick. This depends on the cause of the ILI outbreak. Your manager and public health will let you know when the outbreak is over. If you have any questions about influenza-like illness and would like further information, talk to your manager who can contact your local public health unit. Remember, you have an important role to play in stopping the spread of ILI in your facility.